So deafness and hearing loss are another barrier to communication. The term deaf refers to those patients who are unable to hear well enough to rely on their hearing and use it as means of processing information. It's interesting because it's written in either lower or uppercase and they mean different things. So the lowercase version of deaf is used when referring to the audiological condition itself, whereas the uppercase with the word deaf is used when referring to a particular group of deaf individuals who share a language such as American Sign Language and a culture. The term hard of hearing refers to those patients who have some hearing and are able to use it for communication purposes, but the patients are described as having mild to moderate hearing loss. More than 38 million Americans are deaf or hard of hearing. So this definitely poses a problem in terms of communication in physical therapy. Because the majority of these individuals are 65 years of age older, the number of deaf and hard of hearing patients is expected to increase substantially. We typically work with an aging population in physical therapy, so just be aware that some of your patients that are older may have difficulties with hearing. Ineffective communication between the healthcare provider and the deaf or hard of hearing may lead to misdiagnoses and medication errors, as well as potential embarrassment, anxiety, or fear. So again, keeping the lines of communication open and looking for nonverbal cues is a really good way at managing some of these issues. Interpreters of American Sign Language may be needed in certain situations, so it's okay if an interpreter comes with a patient to the clinic for the interpretation purposes. The healthcare provider must remember to be patient and considerate when we're working with those that are hard of hearing or are deaf. Everyone, especially hard of hearing patients, will hear and understand less well when they are tired, ill, or in pain. So some of those other barriers we were talking about, some of the cognitive processes, they may not pay attention as much as if they didn't have some of these things on board. And it can be marked by strain for these patients to remain attentive for long periods of time when they have pain or when they don't feel well or when they're exhausted. So it may be difficult to have the attention span needed for effective treatment. Here are some strategies that we can use for those that are deaf or have hearing loss. Be sure that the patient sees you approach. Interact directly with the patient when you're speaking to them. Don't turn your back on them. They want to see how your mouth is formulating words, and record and respect the patient's preferred method of communication. I usually just ask them, how do you prefer to communicate? What is the easiest? What is the best way? And then I try to adapt my method of teaching to their preferred method of learning. If your patient hears better in one ear than another, make note of that and try to speak into that side. That makes it a little bit easier for that patient. Gain the patient's attention before you speak to them. We also want to speak clearly and in a normal tone of voice, a little more loudly and at a moderate pace. For some people may be indicated, or we have to pause between phrases as well. So just take your time, be patient with some of these individuals, and know that there may be a delay in terms of time when getting information across. We want to optimize conditions for speech and reading, minimize the use of medical terminology, so trying to take out medical jargon and make use of very simple words. We want to try to maintain eye contact with the patient. Again, this is a cultural thing, so we have to be aware of the patient's culture as well and see if this is appropriate. We have to include the use and observation of nonverbal communication. We want to rephrase, paraphrase, or write a message out to a patient. That seems to be very helpful as well. We also want to indicate a change in topic so the patient doesn't get lost. Sometimes we want to supplement the conversation with visual aids. And I like to employ teachback. I like to have the patient paraphrase to me what I just said, or express to me what I just said, to make sure that I check their level of understanding.